Did you ever had a cramp in your muscles so severe that you could not move your body? Hi, I am Dr. Sheetal Mundhada, and in this video we are talking about dystonia and why cramping of the muscle should not be ignored. Dystonia is the condition that tightens and contracts the muscle and to be in the squeezed position for some time. It happens as a result of an abnormality of the part of the brain called basal ganglia, which is responsible for the movement. Dystonia is the movement disorder that causes the muscles to contract and that causes abnormal repetitive movement, twisting and tremors. The condition could affect the one part of the body called focal dystonia, the multiple parts of the body called a segmental dystonia, or the entire body at once called general dystonia. The muscle contracts abnormally when you initiate the movement, and it gets worsened when you try to doing this movement for a long time. This involuntary contraction is so strong that it does not allow your body to move and it gets twisted. It happens most commonly in face, neck, leg and arm. It also happens in blinking of eye muscle, tongue and jaw. You will feel pain, repetitive uncontrolled movement, twisting of the body and difficulty in continuing the movement. Risk of dystonia increases if you have a history of Parkinson's, stroke, traumatic brain injuries, tumors, infection, oxygen deprivation, carbon monoxide poisoning, heavy metal poisoning, birth injuries or reaction to any medication. Motor learning exercises are important to retrain the affected movement and functions. Stretching exercises are important to get rid of muscle tightness and enhances the flexibility. Active mobilization techniques are important to reduce the stiffness and the movement of the joints. Active mobilization techniques are important to prevent stiffness and the restrictions in the movements of the joints. The strengthening exercises of the affected muscle is important to reduce the pain, to improve the activity and other muscles to prevent the further functions. Relaxation technique should be used in the form of deep breathing, cryotherapy, hot fermentation and others. I hope this video helped you to understand dystonia and how to do management. For more such educational video, don't forget to subscribe to your physio.